Next, it's not one of the best known cancers, but it's one of the most deadly, cancer of the esophagus. Well, last year it killed nearly 8,000 people because it's very hard to spot in time for a cure. Now, doctors and physicists in Cambridge have joined forces to develop a new type of camera that could pick out abnormal cells before they develop into cancer. It's been paid for by public donations to stand up to cancer, and the first trials on patients are about to begin. Our science correspondent Richard Westcott went to see how it works.
Right now, this is how you find one of Britain's deadliest cancers.
Close. Open.
Esophageal cancer kills 21 people a day because it's so difficult to spot. Using a camera with a normal white light on the end, the doctor's looking at the dark red patch. It's a condition called Barrett's esophagus. Not dangerous in itself, but it can contain cells that turn cancerous, if you can find them.
Early cancer appears as reddened mucosa, but because we are looking at the contrast between red and red, this might be very difficult to appreciate.
So colour is a problem, and colour's also a solution. These physicists already use different coloured lasers to study electrons. Now they're adapting the technique to look for early signs of disease. The current camera looks down the throat using white light, and that makes it quite hard to spot the cancer. The new camera is going to look using different coloured lights, and if they get the right colour, it should make the potentially cancerous cells glow.
What happens as the tissue becomes cancerous is that you get a change in the chemical composition, and different chemicals have different colours, which means that if we look at the cancer with a technique that allows us to capture information from all of the different colours of light that are being reflected, we can get a fuller picture of the disease state that's present.
And this is how it might look. The ideas come from a Cancer Research UK programme across the city where scientists, engineers and medics are joining forces to find cancer early.
Most of our patients present late, and for esophageal cancer, as an example, 2/3 of our patients will present with a cancer that's already spreading to the lymph glands, and then after that it can go to distant organs like the liver. If we treat a cancer at the point at which it's still within the tissue itself of the esophagus and it hasn't spread anywhere at all, then we can remove it all and cure it.
And that's exactly what happened to Jackie. They caught her disease in time, and now she's fine.
I knew there was something wrong. People shouldn't have heartburn for 20 odd years. Well, actually it was 30 odd years. So, yes, you've got to be diagnosed early, because when you're diagnosed early, they can do something about it.
All done.
They'll start trialling the new camera on patients in the next few weeks. If successful, it could also be used to spot other cancers before they become fatal. Richard Westcott, BBC Look East, Cambridge.
Well, joining me now is Dr. Sarah Bonedeek from the Department of Physics at Cambridge University. It's amazing to think that this breakthrough was a chance conversation that you had.
Yeah, it was a really lucky one, actually. We were already developing these cameras in the lab where we could resolve many more different colours than usual. And I was at a meeting with Rebecca, also happened to be at. We were having a coffee conversation, and it turned out that she had this amazing problem that suddenly we could put our solution towards.
So how soon was it before you actually came up with the camera?
It took us a little time to develop, and we also had to apply for funding, and we were really lucky for all the fundraisers who work and generate money for Cancer Research UK. We were able to get a grant to then start working on this project.
It's amazing, really, isn't it? A huge achievement, detecting a potential cancer before it even develops.
It's such an important problem. Catching the disease early means that you can cut it out, and you have a much better chance of the patient having a full recovery and going on to live a normal life.
So how important is it, this collaboration between different departments? You've got physics, medicine, engineering, you're all getting together for these breakthroughs.
It's absolutely vital. None of us can have the expertise in all of those different topics together. So if we combine forces and really work together on these, we can come up with amazing new ideas.
Well, that's just it, isn't it? I mean, what happens next? I mean, could this particular camera that you're using for esophageal cancer, could it be developed to detect other cancers before they even develop?
We think that some of the common chemical changes that we can detect by looking at these different colours actually could be signs in other cancers as well, and it would be an obvious option to try and look at colorectal cancer, for example, in the lower gastrointestinal tract, maybe also look at some early forms of lung cancer, and we'd like to expand beyond that as well.
So will you be working on that next?
That's definitely a direction that we're taking forward in the lab, yes.
So how exciting has this been for you? I mean, you've obviously been doing this for some time, but to actually get a breakthrough like this, it's quite something.
It's amazing. I think it's great for me personally to have come from a physics background and developed these new ideas. And gradually, after sort of doing all the technical work in the lab where we're sort of using nuts and bolts, physically putting things together and building systems, to take it from that very basic approach and then actually see something that is being used in a patient and delivering a potentially transformative change is really exciting for me, and it'll make a really big difference, inspiring, I think, others also to get into more biomedically applied research.
So it's at the trial stage, it's about to start now. So how soon people will want to know before this camera is in widespread use?
Well, this is obviously a very early trial. It's an exploratory trial, so we're just looking at a very small number of patients to see whether this camera performs well enough that we can detect these early changes. If those initial results are promising, then we'll have to think firstly about developing new computational approaches to actually interpret the images, and there we'll bring in some technology, for example, from artificial intelligence to try to help us work with the data. And from there we'll look to do a larger clinical trial before ultimately going on to apply the technique in a broader setting, and hopefully in the very near future then be able to use it to help patients.
Dr. Sarah Bonedeek, thank you very much indeed for joining us.